Good morning. My name is Corina Herrera-Loera, Public Information Officer here at the Emergency Operations Center with Santa Clara County. Welcome to Facebook Live. We will be taking off our mask. Well, I will be taking off my mask during this segment so you can understand me more clearly, and our ASL interpreters can also understand and interpret. Thank you all for joining us today. We have today Jessica Gonzalez, who's a school counselor for Eastside Union High School District. And we will be talking about the importance of mental health during a pandemic and how stigma can make a problem worse. We will also talk about the fatigue and how it can make some people stop following guidelines and let our guard down. It is very important to regain control and raise our guard, especially by wearing our masks, maintaining our social distance, 6 feet apart at least, remembering to wash our hands for 20 seconds, and if we do have anybody maybe visit us and we don't know, meet with people outdoors. Also, we must take the test once a month or every 2 weeks if possible if we're essential employees. As community members, we are reminded daily of the pandemic, of the alarming numbers that continue to climb, and going into purple, many begin to feel the effects of this pandemic, which can result in feelings of anxiety, depression, or even isolation. So we have a very important topic to discuss today. Welcome, Jessica. Thank you for being with us.
Thank you. Thank you.
And let's start with our first question. What would you say to people who are beginning to feel these feelings, whether anxiety, depression? Is it normal? Should they look for resources?
So I would like to first emphasize and make it very clear and normalize that all of this is normal. It's normal to feel anxious. It's normal to feel depressed, to feel isolated. The world is changing. The world has always changed, right? We've always experienced different changes, right? But sometimes, you know, when things happen or changes happen across the globe or across the country for us, we don't feel that impact because it isn't directly affecting us, right? So this time change came fast. It came unexpected, uninvited, and it is affecting the entire world in the same way. Some of us more than others, obviously. So we've had to make adjustments from one day to the next, literally. And those adjustments have impacted our lives, right? Those adjustments are made to our lives, our daily routines. Some of these changes are self-imposed. Some of these changes are imposed by external demands, right? Like what we're having to do with our masks and, you know, social distance, not gather with family. And so all of this is really testing our resilience, our spirit, our emotional state, right? Because uncertainty leads to anxiety. Right? So we don't know what's next. We don't know what's going to happen, right? Social isolation leads to loneliness. So all of these feelings that we are all going through, because we are all going through them, definitely impacts us. And this is definitely normal. And so when you start to feel these emotions or become part of this state of mind, it is really, really important that you do seek help, that you do seek the resources that the county has laid out for us. There also are resources that, if you have children at schools, they can refer you to, which will possibly and more than likely be the ones that the county has outlined for us to lean on, right, if we need that help.
Thank you. And what would you, as a counselor, at a high school, seeing youth, would you say that there are more youth seeking services nowadays during this time?
You know what? Here at the school that I'm at, we definitely see the self-referrals, right? The students asking for the help because they know they are being impacted. They know that this is affecting them very much emotionally and mentally. And we work with our social worker who we make the referrals to, and she has definitely seen a big increase in self-referrals, right? Because usually what happens here is the teachers or staff members or counselors who work directly with the students will make that referral to our social worker, right? Either she'll start meeting with them or she'll refer them out to outside community resources and agencies. And this time around, what she's seen is an increase in self-referral. So students are actually seeking that help because they know they need it and they feel that it's going to help them.
That's great to hear, especially the youth seeking those services on their own. And so, we want to encourage, right, like Jessica mentioned, we want to encourage adults to also do that. And something else I want to touch on, as we've discussed, is the stigma. Stigma, we'll start with stigma around COVID-19, right? What that means. If I have it, I'm not going to say anything because I'm going to be looked at differently. People are not going to want to invite me or talk to me. And so we need to get away from that, making it, we didn't invite, as Jessica said, we didn't invite this disease, into our communities. And so it's not something that we created, and it's something we can't see. And so anybody can get it. Anyone can get it at any time. And so we need to normalize, that if we do have it, we need to speak up and say, hey, I'm not feeling well, right? Or I tested positive and I know I have it. I can't see you. I can't come to work. Our children cannot see each other. We need to be honest with ourselves and with others. Also, if we know somebody that has it, we need to be understanding. We need to support, right? They can't go out to the grocery as anybody else that might not have it. So supporting our neighbors, supporting our family members, leaving groceries at the door, we get to support one another. Instead of seeing it as, something like, oh God, they have it, let's not talk to them or let's not see them, we get to support one another. And we get to come closer, especially during these times, to lower these numbers. We sometimes have family members that, want to come over, want to invite us. We get to be honest and say, not today, not anytime soon. For now, we know that it's 14 days of quarantine. But even that, right, if we can stay away from folks longer, then let's do that. And seek out services, resources for a county. If you need to quarantine yourself and you live with others, and you can't be there, we have resources. So just call and make sure that we support one another to maintain those numbers from going higher. We need to get those numbers down. And so, Jessica, in regards to mental health services, we also know in certain communities, it's like, don't say anything, keep your problems to yourself, don't talk to anybody. What would you say, around that? Whether it's help for themselves or help for their children or even a niece and nephew, a family member. What would you say around that?
So we shouldn't be ashamed, right? We shouldn't be ashamed that we're sick or that we, have COVID or that we've had it. We shouldn't avoid seeking help. We should say that if we've been around other people, we should share that because that is acting in a responsible way, right? We as an adult are modeling how to deal with an issue, how to deal with a problem to our younger generation, to our children, if we have children in our homes, right? And so when you take responsibility and you hold yourself accountable or you take that accountability, like, you know what, I've tested positive. I know we were having dinner outside or whatever it was last week, and I really need you to go and make sure you get checked. Or it's part of our responsibility as human beings, as members of the society, to keep one another safe, right? That's what we're doing. We're not trying to become more isolated or become, the black sheep or what have you. It's about building community, having the responsibility or empathy to make sure that everyone around you is okay, right? And when we do that, when we make sure that to check in or to, say I need help, we're modeling to our children how to solve problems, right? How to deal with issues, right? And if the more we do it, the more we normalize it, the more it's going to be okay and to be part of what we do moving forward, right? This is a time where we've had to reinvent ourselves, right? And really look inside, reflect, You know, how do I want to move forward in life? What kind of a human being do I want to be, right? And this is definitely a moment in time where we get to do that, right? It's not easy. Making changes is not easy, as we all are dealing with, right? But it's so, so important to do that, not just for yourself, but for everyone around you. If you don't have children, but people around you, you know, society, those who you work with, it's super, super important to seek that help and normalize it and not be ashamed of it.
Thank you. And I love that, right? It's a physical help with the COVID and that mental health and emotional part, right? Like when we have a need to then seek out that support or help one another. You know, mentioned, I have a friend, I have resources and services where, you know, I have a number where you can call at any time, especially when we start seeing some of the signs. And we'll be going over that in a little bit. And before we go into that, I do want to talk about the, you know, just me feeling. You mentioned a little bit about the isolation, that loneliness, where sometimes it's like, you know, you're at home, you're like, it must just be me feeling this way. You know, why is everybody, you know, feeling great or doing great? You know, why do I feel like that? Can you talk a little bit about that feeling and how can someone process maybe that negative energy into something positive?
Right. So when we are isolated or when we are alone most of the time, we feel like it's just us, right? We're the only ones who are dealing with that issue. We've lost that connection, that physical connection that we've all been used to, that we've all known, right? So again, going back to that, everything that we've known to be normal right now has changed for us. So it's hard, right, to look at it, right, with how I know my friend or my coworker is dealing with X, Y, and Z just as I am, and they're feeling the same way as I am, because we're disconnected in that physical form that we've all been used to, right? So right now, we're also receiving a lot of information, like information overload, right? Our routines have been disrupted. So things that we can do for ourselves and to change this negative energy into a positive energy and a positive way of moving forward is to tune out for some time, right? So if we're receiving all that information overload, and when a lot of that information is negative or it's just kind of like a downer, right? It makes you feel really like sad and overwhelmed. You're naturally going to feel that same way, right? You're going to feel that negative energy, just the sad information about rates going, I mean, percentages going up of COVID cases, the death rates going up. That's heavy stuff. So it's important for you to build boundaries, right? Like say, I'm only going to look at my news or the updates for my county or for my city and to make sure everything's okay, no changes have been made, I don't have to make any changes to my daily routine, and then turn it off, right? And then tune into something that's positive, that makes you laugh, that brings you joy, that brings you peace. Like those things are very, very important. So setting boundaries with the information that you're receiving is very important. The other part is that, you know, we've had our routines disrupted. So finding a new routine, a new daily routine is going to help you, right? Building new habits, waking up. Maybe this time around we don't have to worry about that commute. So that gives us time to wake up, have some tea or some water, you know, do a mini meditation or sit outside, breathe in some fresh air, you know, go back in, start your connection if you're working remotely from home, whatever it is, right? That building a new routine that's going to help you feel better.
Thank you.
So those would be my suggestions.
Thank you so much. And I do want to highlight some of the resources that we have here in the county through our behavioral health services. And so the phone number that we have here for our call center for behavioral health services is 1-800-704-0900. And you will see on the screen a list of the different phone numbers and resources that we have. And let me just go back to that call center number. When you call, you will have an option from various choices. The first one will be the suicide hotline. You know, and depending on the needs, you will then mark and go to that choice. The second one will be the mobile crisis line, where somebody can come out, and we have behavioral health services providers coming out and can respond mobilely. And then we have an urgent mental health services option. And then the next one, we have a referral to mental health or substance use services. And then the next one will be general information. And so these are the different options that we have. If you're calling and it's an emergency, obviously you will be encouraged to call 911 depending on the situation. But there are many services and resources in our county for behavioral health, for mental health resources. And so as Jessica mentioned earlier, we know that gyms are being closed. We know that, some of us had gone back somewhat to our regular routines where we were working out, or doing things, that were making us and helping us kind of feel a little bit more normal, and we had to close down, right, and go back to the purple tier. I just want to highlight, right now, Jessica, since we can't visit one another, and we can't see, people that we were maybe seeing, because we were at the point where we were gathering with 2 other families, what can you highlight and maybe even, mention again, right? That's healthy for our families during this time, especially maybe during the holidays, that are coming. People had maybe other ideas of what they were going to do, but we have to come back and, stay home these holidays coming up. Any thoughts on that?
So again, it's all about reinventing ourselves, right? And it's really hard, and I understand, right? Because it's a change in what we've been used to. So really thinking about what are other ways that I can connect, right, with my immediate family. What can I do? How can I make this different? How can I make this a little bit more special, right? Or this dinner tonight, or what have you, or this birthday. How can I make it, am I going to go back to Zoom calling or Zoom parties, or, what about writing letters? We've kind of lost that, right? I remember growing up with writing letters to my cousins or to my aunts and uncles. It was not just in another country, but, across the state or in another city. So reinventing ourselves, but also looking back at what we used to do to communicate and stay in contact with people, right? I think those are really important things to kind of just think about, and it could be a really great family conversation over dinner about, okay, so what can we do differently? What would you like to do, right? What can we do? How about we send a note to everybody that was supposed to come over this Thanksgiving? Or how about we send a note to, Tio Luis, because I know he's feeling sad, he's home alone, or whatever it is, right? How about we call him, or how about we set up a Zoom meeting so we can talk and, just connect and catch up. Just different things, or things that we started to do at the beginning of our shelter in place, or when the pandemic first came here to us, to just keep connected and try to stay hopeful, right?
Yeah.
Because that's all we can do.
Those are great ideas, and so it's all about lifting the spirit, right, of ourselves, of our families, of those around us. Another idea I heard from one of our coworkers was like, we can't go out and have Christmas with others, but we can bring Christmas home, and so those little things that really lift that spirit for yourself and others around you, right? Thank you so much, Jessica, for joining us today. I appreciate you coming, to share your wisdom with us. And so, to the community out who's watching us, let's remember, maintain social distancing, wear our face masks, make sure to wash your hands, and make sure that your holiday plans look different from last year. If for some reason they look the same, there's something wrong. This year, we need to make sure that they're different. And so with that, also, I want to highlight some of the testing resources that we're having in our county coming up. We will have a testing site in the east side of San Jose on Story and King, next to the Cardenas shopping center. In that shopping center next to the store, you will see a clock tower, and go in through those doors. You'll see on the screen, where it's located, and then also the times. It will be next Wednesday, and then there will also be an opportunity in December to also go there and get tested. So make sure you do that. And then also I want to highlight that just because you get tested and you test negative, it does not give you a pass to travel or to be around others, other than your household. What it means is just that in that moment you tested negative because you don't know what's happened after that. And so usually you receive your test, could be from 3 days to maybe a week, or more. There's things and people that you've come in contact with between that time. You don't know who they've been around, and so it does not give you a pass. So just remember that, it's for the moment in time. We get to continue to test ourselves. If we're frontline workers, we get to test ourselves every 2 weeks. If you're not, try to get tested monthly. We need to make sure we bring our rates down. Everything we do will support. As we know, we've done it before. We brought our numbers down. We can do it again. We just got to tighten up. Thank you so much for joining us, and we'll see you the next time.